I'd like to take advantage of these short video segments to respond to actual letters that I've received from you, the constituents.
Matthew from Woodhaven is writing to you about Medicaid expansion. Senator Colbeck, I urge you to vote no on Medicaid expansion. The country, and the state of Michigan in particular, cannot afford to expand the program.
Matthew, I couldn't agree with you more. The one thing that gets lost in the debate over Medicaid expansion is that everybody shares the same goals of expanding access to quality care, of lowering the overall medical costs, and improving the quality of care. The problem is that there's different ways of going off and approaching that. And the approach that's being taken right now in regards to Medicaid expansion is nothing but implementation of Section 2001 of H.R. 3590. Most people know H.R. 3590 as the Affordable Care Act or Obamacare. And the Medicaid expansion is simply just implementing that portion of the Affordable Care Act that would lead to a single-payer system. And when you have a single-payer system, you don't have any of the competitions that actually lead to improved quality, that lead to decreased costs. Thankfully, I did approach it from a different perspective, and I said, instead of just simply saying no to Medicaid expansion, I said, all right, if these are our objectives, I'd like to actually go off and define a plan or define a solution that actually achieves those objectives. And I did develop such a plan. It's called the Patient-Centered Care Solution. And you can find it at morninginmichigan.com. In that plan, we actually do achieve that promise of actually lowering the cost of medical care by as much as 30 to 40%. We actually improve the quality of care because now everybody has access to a primary care physician. Under Medicaid, they don't have that access. And we have a much better system because it's based on the free market, not based on some top-down government control of each and every one of our daily lives. And my contention since the beginning around the Affordable Care Act, since I first read all 1,017 pages of H.R. 3200 and a significant chunk of H.R. 3590, is that it's very obvious that the current health care law coming out of the federal government is more about control than it is about care. If it's about care, you don't need 159 organizations between the doctor and the patient. If it's about control, those 159 organizations come in pretty handy. So I share your concerns about Medicaid expansion and fought aggressively against it, and I went beyond just simply saying no, but I provided a better solution.